some things that you've got to stop to control diabetes. And these two head the list, plus caffeine. Caffeine gets an insulin response. One of the reasons why some diabetic nurses aren't advising that, because what are they drinking themselves? Dairy. Now, I'm not talking about Lulabelle in the paddock who's eating organic grass and gets milked and drunk. You know, that's been happening for centuries all through the northern European countries, and it hasn't caused diabetes. See, today, the milk is altered. Today, the cows are given... Do you know 80% of the antibiotics that are made go to animals? But what happens with the dairy when it breaks down in the gut, and the current figures, this was in the newspaper, that 60% of Australians cannot handle dairy. Now, if we change that to organic raw milk, it'd bring it down to probably 30%. They can't break down those large globules in their gut. And so what's happening is molecules are getting into the blood that shouldn't be in there. Let's say the molecules that are broken down from the dairy look like that. So what happens now? The body creates antibodies. Let's say this is an antibody to actually wipe that out. So they wipe out the antibodies, and then they look across, and the beta cells in the pancreas have a similar structure. So these antibodies that were created to wipe out those molecules broken down from the dairy, they come over and start wiping out the beta cells in the pancreas.
Dairy intolerance, often referred to as lactose intolerance, occurs when the body cannot fully digest lactose, the natural sugar found in milk and dairy products. This condition arises due to insufficient levels of lactase, the enzyme responsible for breaking down lactose in the digestive system. While not typically life-threatening, dairy intolerance can cause uncomfortable symptoms and may lead to long-term dietary and health challenges if not managed properly. Symptoms of dairy intolerance. Symptoms usually appear 30 minutes to 2 hours after consuming dairy and may include digestive discomfort, bloating, gas, diarrhea, stomach cramps. Other potential symptoms: nausea, headaches or migraines, in some cases fatigue or general discomfort. Causes of dairy intolerance: lactase deficiency. Primary lactose intolerance, a natural decline in lactase production with age, common in many adults worldwide. Secondary lactose intolerance, caused by gastrointestinal conditions like Crohn's disease, celiac disease, or infections that damage the lining of the small intestine. Genetic factors. Lactose intolerance is more prevalent in certain populations, such as East Asian, African, Middle Eastern, and some Mediterranean groups. Milk protein sensitivity. Though often confused with lactose intolerance, this refers to difficulty digesting casein or whey proteins in milk. For individuals with diabetes, managing dairy intolerance can be particularly challenging. Blood sugar management. Lactose is a sugar, and poorly managed dairy consumption can affect glucose levels. Alternatives: replacing dairy with lactose-free or plant-based options is important to maintain calcium and vitamin D intake without affecting blood sugar.
And it is in that way that the dairy is contributing to the diabetes. How many people in Australia wake up to those four? Isn't it true that many do? Not realising the danger. Many are sick through ignorance. So, to conquer diabetes, these four things have to stop. Number two, another important point in conquering diabetes is hydration. The hardest time to drink water is in the cold weather, is that right? Well, boil the kettle and make it hot water. Put a squeeze of lemon with it. You just got to find out some way to get it in. Because your pancreas needs water to make these hormones that control your blood glucose levels. In fact, If someone's blood glucose levels are going down and they take a glass of water, do you know that will cause a release, or the body to help release some of the glucose to bring it up a little bit. But not only hydration, which is approximately 8 glasses a day, but also salt. Now it is at this point that I'd like to explain salt, because this will also help with the blood pressure. So your seawater has 92 minerals, and of those 92 minerals, 30% is sodium. Can you see how God meant us to be having sodium with all the other minerals to buffer it out? 50% is chloride. And because these make up the largest amount of minerals, when the first crystals are formed, when the seawater's evaporated, when the water's evaporated from the seawater, sodium chloride. So they scoop that up, no time to wait for the rest to be evaporated. Bleach it white, put aluminium with it, there's your table salt. Table salt has 2 minerals. Yes, it is true that table salt will help the blood pressure to go up because it causes a mineral imbalance in and out of the cell. You see, the highest concentration of mineral inside the cell is potassium, and the highest concentration outside the cell is sodium. So when these are taken in these high amounts, it causes an imbalance. The doctor's right. Table salt will get the blood pressure up. And so will no salt, because your cells need that little bit of salt. So my suggestion is to take the Celtic salt. The Celtic salt contains 82 minerals, and the Himalayan salt, it contains 75 minerals. One of the beauties of the Celtic salt is it has 3 magnesiums, and magnesium is a muscle relaxant, and magnesium relaxes that heart at rest.
While salt is essential for certain bodily functions, excessive intake can influence blood pressure and indirectly affect blood sugar regulation. High sodium intake from table salt can cause the body to retain water. This increases blood volume, leading to higher blood pressure. Chronic high blood pressure hypertension can strain the heart, kidneys, and arteries, increasing the risk of cardiovascular disease. Some individuals are more sensitive to sodium, meaning their blood pressure rises significantly with increased salt consumption. Salt doesn't directly raise blood sugar levels. However, high salt intake may increase insulin resistance, a condition where the body struggles to use insulin effectively, potentially worsening blood sugar control over time. People with hypertension due to high salt intake are at a higher risk of developing type 2 diabetes, as the two conditions often coexist in metabolic syndrome. Processed and packaged foods often contain both high sodium and hidden sugars, which can exacerbate blood sugar imbalances. Balancing salt intake and choose the quality salt are simple yet effective steps toward better cardiovascular and metabolic health.
Dr. Lee Langry is a French doctor who's written a whole book on salt. If someone comes to him with high blood pressure, he puts them straight on Celtic salt. If they're not used to any salt, start small, start very small, and then little by little ease it in. In Matthew chapter 5 verse 13, it says in the Bible, "Ye are the salt of the earth. If the salt hath lost its savour, wherewith shall it be salted?"